Techniques versus principles. First and foremost, osteopathy is a way of thinking, not a way of manipulating. Many modalities use the same techniques: strain, counter-strain, facilitated positional release, muscle energy. So what makes it osteopathic when used by an osteopathic manual practitioner? It's the thinking behind it. The thinking does the assessment. The thinking finds the dysfunction. Then the thinking customizes a treatment for the patient. Osteopathic thinking has its foundation in principles. Combining osteopathic principles with a thorough understanding of anatomy, physiology, and technique, that is osteopathy. Principles are everything. Techniques alone misses the point. The CAO offers the only principles-based program in Canada. Why is this? Over the decades since its inception, osteopathy around the world has been watered down by some into techniques, and in many cases, it doesn't resemble osteopathy at all. The CAO stays true to the original principles of the profession, when osteopathy was incredibly effective. We follow the writings of the founder, Andrew Taylor Still, and the writings of his early graduates. While some schools base their entire curriculum on memorizing techniques for each part of the body, the CAO goes much deeper and teaches the osteopathic principles that govern technique and treatment. This is important because if a practitioner understands the principles of osteopathy and has a full understanding of the anatomy and physiology, they don't need to memorize techniques at all, because they can intuitively create techniques on the fly based on their understanding. This makes for far better patient outcomes because the technique and treatment is customized for the patient in the moment. An analogy that we like to use is the chef versus the short order cook. An osteopathic practitioner who only knows techniques is like a short order cook. They always have to work from their recipes and are limited by them. An osteopathic practitioner who understands the principles is like a chef. Sure, they know lots of recipes too, but their education has developed them further. They understand how the ingredients work together, the chemistry and the physics of the cooking principles, and this allows them to not only customize dishes for the person they are cooking for, but also to create new dishes that have never existed before. This is our goal for CAO grads, to have the expertise and skill to treat patients in a dynamic and customized way. This is why the training is so demanding. It takes a lot of education, training, and practice to become a skilled and successful osteopathic manual practitioner.